Alright guys, welcome back to the channel. I hope you're all doing well. In this video I'm going to be talking about a company with a massive catalyst on the horizon that could shoot the stock price up way higher. So this is Southkey Corp, ticker symbol CVM. Now they have a phase 3 data on Multikind, which is a head and neck cancer treatment, and they've got the results are due imminently. So what Multikind does is it boosts the immune system before the standard of care. So standard of care would be anything like chemotherapy, radiotherapy or surgery for cancer patients. And this the way Multikind works is it tries to boost the immune system so that if any tumours do show up after the standard of care, then the immune system can naturally attack those and get rid of them. So it leads to no regrown tumours at the end, or no micro metastases, so little cancer cells that could end up growing more. It stops that from happening beforehand. Now this trial for the Multikind has been going on for 10 years, and around 928 patients have been enrolled. And currently it's going through a full medical review, so there's no top line data or anything. It's going through a full medical review, and there's no cherry picking or anything, like I said. And this would be good because it increases the credibility for the drug and would quicken the process for FDA approval, which is great for both the company and for cancer patients who, if this drug is effective, then that would definitely change their lives. So this trial, it actually took as I said, it's been going on for 10 years, and it's actually taken 2 years longer than anticipated. Now, my views on why this has happened is it's an event-driven trial, so that means they need to wait for a certain event to happen, in this case for 298 deaths to occur, to then complete the trial and go on to reviewing it. So it took longer for the event to happen, so it took longer for 298 deaths to occur. So my thesis is that the drug does work because it has had a delayed clinical effect, and it has led to people living longer, which is obviously a good thing. Now in terms of the phase 2 trial, so those of you who are not familiar with the biotech sector or the science of trials, so a phase 2 trial is basically a trial on a lower population basis. So in this case it was 20 patients, and that it does the same thing to measure how efficacious the drug is and how effective it is in terms of doses and things. So the phase 2 trials, they showed 42% response rate, 50% reduction in tumours, and 65% overall survival increase. Now this is huge. Even a 10% overall survival increase would be huge for patients suffering from cancer, especially head and neck cancer, where unfortunately there haven't been many medical breakthroughs to try and help people, and the survival rate post-diagnosis isn't very good. So this kind of survival rate is massive for the patients and can really save a lot of lives. And this is why it's such a massive catalyst and such a good thing for both the company and the cancer patients. It has a 40 million share float, and at the moment around 25% of the float is shorted. So any good news from this trial, and it would lead to a massive short squeeze with the relatively low float too. As a $1 billion market cap, if this drug is as good as trials do suggest, and at the moment it does point to this, then this would go to a 10 to 20, even more, $20 billion market cap, as this drug really is a breakthrough in the cancer treatment process. I would put a price target of $80 plus, but with a short squeeze, and if the news is very good, then it could possibly go to 200, even higher. Now in terms of the management, so the CEO is very, very bullish on this, and he also believes that the Multikind will do very well and believes in the process. He owns a ton of shares and options too, and he hasn't sold any of them, which is obviously a good thing. And the company has also decided to go forward to open a center to actually manufacture this and help with that. So they believe in the drug. The trial suggests that the drug is effective. Now we're just waiting for the data Now the data was due early Q1, but that has been delayed a little bit. It might just be a reviewing issue or anything, especially due to COVID, so I wouldn't worry about that. There is an annual general meeting due July the 1st, and I think we should get data by then. Thank you for watching. I hope you liked the video. Please like and subscribe. I'll see you next time.